so we can add that to our YouTube channel as well. So thanks for joining us for the Lunch and Learn for evidence-based research through co-production. And I'm delighted to hand over to two of my very good colleagues, and I will let them introduce themselves. So over to Shahid and Jabu.
Hi, everybody. Thank you for attending. I can't see everybody, but I've just had a quick scroll through and I can see some familiar names. So, hiya, Cara, hiya, Kerry, and everybody else who I work with. I'm Shahid Islam. I work in the Institute for Health, Bradford Institute for Health, as a principal research fellow, focusing mostly on co-production and citizen science, but anything really connected to community involvement and engagement and community inclusive practices. So thank you for attending. Jabu, do you want to introduce yourself?
Good afternoon, everyone. My name is Jabu. I am a research associate, so I work with Shahid, focusing on co-production and citizen science. But the main project that I'm working on is called AIM. So it means Adolescent for Interventions for Mental Health Services. So really focusing on those interventions that help young people. Lovely to see you all.
Great stuff. So before I make a start, it's probably just worth me saying I end up talking to many of you individually about your projects to think about PPIE, co-production, citizen science, pretty much anything in the realms of community involvement and engagement. And so we thought, okay, let's do a session which probably will answer lots of those kinds of questions that come up at an individual level. So this is high level, and we're going to go through the process of giving you some high level information, but then bring it back to a very specific example. So there's going to be some interaction, and there's going to be lots of information thrown at you, and then there'll be an opportunity for you to ask questions at the end. If you want to type things, I won't be able to see them, but I'm sure Kate will bring them to our attention. So let me start. So first of all, let me start by talking about some terminology in research or terminology generally in the world of involvement and engagement. Engagement comes up quite a lot in conversations, so does involvement, so does participation. And if you want to start typing just as a flavor of how you think these things are, that would be quite helpful to us in the chat. But whilst you do that, I'll just share with you what involve describe as these three terms, because they are very different and distinct from each other, but often end up getting conflated. So engagement, community engagement or engagement generally is really considered, according to Involve, which was the institute that was sat within NIHR, as just informing people and making people aware about things, aware about your research, aware about your activities, aware about interventions, aware about new services. Community engagement doesn't require people to do anything. It's just our way of sharing things with them, whether we do that through Facebook posts, whether we do that through radio broadcasts, through science festivals, through any means of getting information out there. The idea being that more people who know about things, the more likely it is that they possibly will get themselves involved or will participate. So that takes me on to involvement. Involvement is distinct from engagement because, as the name suggests, it means that there's an opportunity for people to do something which gets them into the depth of doing something with whatever it is that you're doing. So it's an opportunity to influence and direct change. Often when we talk about involvement, we end up talking about PPIE groups, and that's the bit where involvement really comes into its own. It's giving an opportunity for members of the public to influence change or to influence your direction or to influence your design of study or anything that you're thinking about doing. That's where involvement becomes an important thing. And participation, sometimes people use this term to talk about involvement, but according to Involve, participation is not involvement. Participation, in our terminology of, at least in health research, is recruiting people to a study. And it's important to get this terminology right because often I end up seeing people using these terms in a conflated way. So I just wanted to share that as a starting point. Now, if you were really interested in reading a glossary of some of these terms and how they apply differently in different contexts. Neil and I wrote an annotated glossary of inclusion in healthcare a few years ago, just to sort of really outline how these things are different. And we didn't only talk about those three things. We talked about things like community development, which is a completely different thing to involvement, engagement, and participation, but people often use it in a conflated way too. If you wanted to know what community development is, well, according to the literature, it's a social process for communities to gain control over a frustrating and changing world, how timely that might be right now. And so it's things like civil rights movements, justice campaigns, community campaigns to save their local services. Those kinds of things fall under community development. And community empowerment is another one that people often talk about. And really what community empowerment is, very specifically in the terminology in the paper that we published, is giving communities complete power over something. So these things are all different and distinct from each other. So I think that was quite an important starting point to get us going. I think Kate might share a link to that to that paper if you wanted to see it. Co-production then is different to all of those things. And I suppose that's what we really want to talk about today, but we'll still come back to PPIE and involvement and engagement and participation. And a little while ago, we pulled together a co-production strategy as part of our work with ActEarly. And it really was difficult to define what co-production is. It's not really easily defined because it's a philosophy and a way of doing things rather than a very specific thing that you can really give a term, you can really define in a tight way. But if we were going to attempt, Nesta have made an attempt, and it's a definition that we broadly agree with and we've included in our strategy. If I can also just say, just pause for a moment to say, I have done a lunch and learn session previously on how we do co-production and how that strategy came about and what we learned and what we included in that. And so that is available, and I think Kate might have a link and might want to share that with you for those who haven't seen it previously. Anyway, going back to the definition of co-production, and I won't read that out, but there are key important pillars, and those pillars are included in our strategy. And this is what it looks like if we think of it as a Greek temple. And those three pillars are the pillars that hold up the roof of co-production. And without this, you're not really able to say you're co-producing. So equality, and I think that's one of the strong ones that came out, is a solid pillar of co-production. And it's worth me just saying, and I covered this in the previous session, but it's worth me just covering that ground again. It's about sharing power between professionals and communities as a key part of that equality. But it's also a focus on who is involved. So it's parity as well as making sure the equality of who is involved. If our research, for example, is on a particular demographic, if I pick a very simple example, let's say it's on young adults with addiction issues, and we wanted to set up a co-production program of study or a project, then we would really have to find a way to get those young people who have got addiction issues to be part of that study, to be partners with us in that study, for us to say we're going down the route of doing co-production. So equality is a very strong pillar, which is what we've included in our co-production strategy. The next one is agency. And this is one that, if I can just give you a little bit of a simple definition of what we mean by agency, and I've taken this from Amartya Sen, who's a Nobel laureate for winning a prize for economics. What a person is free to do and achieve in pursuit of whatever goals or values he or she regards as important. That's one definition of agency. Another simplified version is agency is the person's ability to act on what they value and have reasons to value. So I suppose the key point I'm driving at there when I'm talking about agency is, instead of having people who come and agree with what we have got to do and what we want to say, and be nodding church and dogs to that idea. It's a case of what do they want to see change and what do they see as important? What do they value? And how do we make sure that that gets included? That's a key pillar for co-production. The third one, which is a bit of a mouthful, but I'll say is reciprocity. So when we're setting up programs of work or projects, so I'm talking mostly about research here, but this applies in contexts which are not always about research. If we want to say that we are going down the route of trying to achieve co-production, reciprocity is quite an important thing. What's in it for the communities? So we know what's in it for us. You know, we're going to get a research project completed, we'll get papers written, we'll get grants about these, you know, to fund this work. But what's in it for the communities? And unless you can define that and work through that with the communities and define that in a way that they can see something that's going to be beneficial to them, then you're not really going down the route of co-production. What kinds of examples need to be included in that? Things like improvements to local services or potential improvement to local services. That's a reciprocal thing to include. Training opportunities for members of the public, things to add on to their CV, opportunities for volunteering. There's a massive evidence base now about volunteering being good for health. This is an opportunity for you to volunteer. And if they're not volunteering and they're getting paid for this work, then that is a reciprocal arrangement. These things are all important for co-production. So values are crucial for co-production to work. And at the bottom end of that diagram, you can see some blocks that hold those pillars in place, and they're the principles. And in the strategy, you'll see we have got 9 of them. I'm not going to go through each and every one. You can see that in the previous lecture if you wanted to, but it's worth just saying that without these principles, it's hard to operationalize those values. And these principles are what came through our appreciative inquiry when we were doing research about what makes co-production different and distinct from other forms of community involvement, engagement, etc. So these are the principles that are quite important. So I'm hoping by this point you can see that patient and public involvement and co-production might have overlaps, but they're distinct and different from each other. And so just by way of an example, we want to try and sort of energize your brains, and Jabu will now walk you through an activity. This won't take too long, but it's hopefully going to be engaging. Jabu?
Yes, hello everyone. So we've got a bit of a task here. Don't know if you have a volunteer to read it out for us. I've seen Jenny. Sorry, Jenny, to put you on the spot, or anybody else who can just give us a quick read. If not, I'll read it. Okay, so this is a scenario. It says, David has a mental health condition and smoking helps him to feel calmer. So he joins a research study to explore ways to help people stop smoking. David feels bad when people judge him for smoking. He worries that stopping might make his mental health worse. So earlier, my colleague Shahid talked about PPIE and co-production. So there are 2 parts to this task. So the first part of it says, what role does PPIE have in a study like this? So earlier, Shahid was talking about PPIE. To start off with, it means patient and public involvement and engagement. So in terms of involvement, that's where we can get people like David, or let's say if it was yourself, if you're a patient, to be involved in the work. So from the very beginning, you might help us to decide what the research question is, and then you might help us with the methods in which to go about looking at that research question, and then we can break that down to looking at interpreting that data, and then deciding what's really important to that participant like David. And then let's say with engagement, again, Shay touched on this. This is when information is shared, and we want you or people like David to see that information and to be made aware of it. And he also talked about participation. So participation is when people like David can take part in the study as if they were research subjects, really. So in this, let's say if there was any sample to share, David might share that. If there's any sort of questionnaire to complete, he might be part of completing that questionnaire, or he might be interviewed. It could involve things like wearing a tracker if we're looking at maybe tracking smoking levels, or let's say the amount of certain gases being produced, so something of the sort. So imagine you're David and you have a mental health condition, but when it comes to smoking, you feel like you'll be judged for it, and you worry that it might make it worse if you stop. So what role do you think you might play if you are a PPIE member and you wanted to help us in the study? Just a quick one in the chat, or if you want to talk, that's fine as well. You can just raise your hand. We've got some answers coming through there. So let's have a look. Yeah, we've got so we've got some, it says knowing insights from other people that have stopped smoking can help define what support to give to people in the study. Also, cultural differences that might impact, e.g., translations of study documents to allow a more representative selection of participants. Very well, good job there. That's exactly it. So that's the sort of, do we have any more? Oh, yes, thank you, Grace. So, Grace, you've said providing open discussion about the feeling of judgment. What idea, that idea that you aren't alone. Thank you, Grace. And then, Cara, you said as a PPIE member, David, you might be able to work with the research team to design the questions and research methods to make them inclusive. Yeah, fantastic. That is exactly what David would be doing, really, as a PPIE member. So he would have a bit more of a lower and middle contribution level, really, to the research. While when we go into co-production, you will see that there's a more of a high-level contribution. So what you said, Cara, Grace, and everybody else, that is exactly right. So from the beginning, really, because it might be quite a sensitive topic, so David can help us to ensure that the study is sensitive and that it's relevant and it's supporting people like David, especially when it comes to stigmatization of smoking. He might help us with advising the researchers on those non-judgmental approaches that you've talked about in there, Grace. There might be some documents that need reviewing. That's exactly what David would be doing. He will help us to review those documents. That would be his role. And he might even suggest some possible outcomes. So in this case, maybe the researchers might be more interested in David stopping smoking, but there might be some other outcomes, such as looking at his well-being, and that's something that might come up if David is part of this study as a PPI member. To read a few more, so Kate, you said, okay, that's a question. Okay, there's another one. Says David could suggest things the researchers may have not thought about as he has lived experience. Yes, that is correct. So those things could include the well-being of David and not just looking at smoking. So everything that you have said is correct, and well done on that. So moving on to the next section. So the next section of the task is looking at what role can co-production have in a study like this. So we've moved on now from lower and middle contribution to the highest contribution, really, in terms of science and getting the patients and the public involved. So what do you think that role could be? Please type in the chat, or feel free to raise your hand and speak. Yeah, you've got a minute to do that if you're writing in the chat. Yeah. And do you know what role? Oh, we've got something coming through. So thank you, Cara. So Cara, you said that co-production could be used to develop the intervention to stop people smoking. Fantastic. Thank you for that contribution, Cara. So yeah, that's definitely it. Thank you so much. Jenny, you said could help get other people who would do smoke involved. Yes, it's about recruitment. So definitely David can get help with recruitment and looking at recruitment strategies. So that could range from maybe looking at social media. Do we recruit through social media? Do we have to go to community centers to speak to people like David? Do we go to places where maybe people like David might be? Maybe people who are also struggling with the stigma that comes with smoking. That's definitely it, Jenny. So thank you for that. We've got Sundus. Forgive me if I pronounced that wrong. So Sundus, you said that co-production can be used to help develop resources while also considering ways in which mental health is supported. Yes, yes, that is definitely it. So it goes beyond PPIE, where maybe the people like David might just be looking at the study guides, but then it's also developing those guides and those resources, and looking at how people like David can be supported, not just with the smoking, but also with the mental health. So thank you for that, Sundus. So yes, just to add to that, if you have any more, please keep them coming. But I'm just going to add a few things on there. Another one. Laura Jackson, you said that support David with the skills to conduct interviews with others in the same situation. Definitely, I think if we can train David and if David can train other people to have those skills so we can conduct those interviews, if that's the method that we've chosen to collect the data, then yes, that's something that David would also be doing. So thank you, Laura. But David can also work with the researchers to interpret the findings that might come about. David can also, people like David can also co-create those interventions. I think someone spoke about those interventions, what they need to look like, and then considering maybe some other factors that we haven't considered before and implementing it to the research. And David can also help to share the results. So while with PPIE, perhaps the members might just receive that information via social media. With co-production, they go further. So they might help us with sharing the findings. So they might choose, one of the strategies might be to get community groups and researchers and other people like David to meet up, maybe via a workshop, to have those conversations and disseminate that information. So David would be a key part of doing that. He might even share his own story to say that maybe he was stigmatized and he was part of this group. He wasn't feeling very comfortable about it in the beginning, but being a part of this study, he has learned or he has helped to shape that study, and maybe other people have come forward and sought support. So that's the sort of thing that David would be doing. So with co-production, and like with PPIE, so PPIE members can be involved at any point, really, and they might have little contribution, as we said. With co-production, the members are involved, and it is key that they're involved from the very beginning, and that we treat them as equal partners. So from the beginning of the research all throughout to the very end, with co-production, the members of the public or the patients are part of that study, and they really drive it, and they shape what that research looks like. So that is all. Kate, you've got, I think, could David sit on the research steering group with decision-making powers over the nature of the intervention? Yes, definitely with co-production, Kate. David can do that, and this can be making some decisions, especially when it comes to interventions. I mean, I'm sure you can agree that David has a lot of experience, lived experience. He knows what he's talking about. He has a lot to contribute. And sitting on that steering group would really help not just him, but the researchers and other stakeholders, and definitely people like David himself. So thank you for bringing that up. But yes, that was all. Thank you.
Thank you, Jabu.
Did you want to add anything, Shahid, on this?
No, I'm trying to move to the next slide, but for some reason, it's not working. Oh, it is. It's working again. So thank you for that, Jabu. Just to kind of give you a bit of a flavor of like some of the differences between patient and public involvement and co-production. So we're hoping that very short, sharp exercise would do that. Now, I've been involved in setting up PPIE groups for best part of 12, 13 years in a variety of studies, in a variety of contexts. And we don't want this to sound like PPIE doesn't have a role. Co-production trumps everything. It doesn't. Some studies only need patient and public involvement. Some studies are designed and purely need co-production. But when we do PPIE, I thought I'd share a little snippet of something with you if it was going to be PPIE that you want to do. And it's a model of communication which really works really well with PPIE groups. And it's something that we've tried and tested across a range of PPIE groups, whether it's for air quality, whether it's healthy homes, whether it's about mental health. We've tried it in so many places. And we've talked to our public members and they like this way of working. So here is what we do. A patient and public involvement group, as Jabu has outlined and I mentioned at the beginning, is really to work with members of the public to ask them for their ideas and understand how we can improve our plans for research. So they have the lived experience potentially, and they also know their communities. So members of the public will be able to tell you what things will work in what contexts and what things will not work and how you can improve your study design. And that includes things like information sheets and consent forms and who you go and target for your sampling, etc. So each PPIE group that we set up, whenever a researcher comes to that group, we say, look, you're going to be talking to a group of people who really know their subject because they know their community, but they don't know your subject because, research can be esoteric. It's something that you're really familiar with because you live and breathe it and you've written a grant for it or you've got a proposal for it. But that doesn't mean it translates very easily back to the patient and public members. So how do we overcome that? Well, we used Bernice McCarthy's format model for communication to say, when you go to a PPIE group, communicate these 4 things, and you're probably going to get some good feedback and good outcomes from it. So tell them why it is what you are doing. So what's relevant about it? What's personally going to be relevant to them about it? Why are you doing this? And what the gaps are? Communities are really interested in the gaps and they want to know why you're doing something. Then describe a little bit about the concepts and thinking behind it. So that's the what. Tell them, what your intervention design might be, or tell them about what your research questions might be and what your area of exploration is. And then explain to them how you plan to do that. And if you cover those 3 things really well, you get an engaged group. And then if you can move it towards the what if, like if we deliver this, we might know subject X much better, or we might be able to change a certain policy. They're the kinds of framings of conversations with PPIE groups which really work well. And I know it sounds really basic, but that shouldn't negate its worth. It's quite important that having done PPIE groups for a number of years, the number of people who come in really passionate about an idea and spill it out, but don't cover these 4 things and then don't get the feedback that they were really after to improve their study is happens quite a lot. So I thought I'd share this as one thing. But you don't have to sacrifice creativity as part of that process, because PPIE can be done in a very creative way. So couple of years ago now, we pulled together a paper about how we did patient and public involvement as a set of activities, actually, by working with members of the public who were going to be affected by the clean air zone, the CAS in Bradford. And our creative approach meant that we got an illustrator to draw out the 4 different clean air zones that were being thought about at the time and drew them out onto a a large, not flip chart, but better quality paper than that, and invited members of the public from across the clean air zone to talk about how the different clean air zones might affect them individually, their community, and that includes their businesses and, you know, people who hang around in the areas where they live, and what would be the pros and cons of the different clean air zones. So there were 4 classes of clean air zone at the time. And people were really engaging. They were drawing their ideas, they were sketching their thoughts, they were putting post-it notes onto the large illustrated chart that we had. And then we also asked them, okay, if these were the types of clean air zones that were picked, what kinds of research questions would be good questions to include in a study that would be looking at the impact on communities from the clean air zones? So that we pulled together as an activity, got published in Welcome Open to describe what our approaches were. And we really outlined why it's important to use creative images and creative techniques to get people to contribute to PPIE. We didn't skip those 4 processes in that. We just found a different way to deliver that. So creativity is quite a useful and conducive part of doing PPIE. And if there's a few ladders circulating in the world of community engagement and public involvement. Arnstein is the most popular one, 1969, which I think a lot of people know. There's another one called By Heart, which is looking at involving children. I've picked the most simplest one for this illustration, and it's in that paper that I mentioned right at the beginning with the glossary, to say there are different levels of engagement and involvement. And if we think about community engagement, how I described it earlier, it's at the first rung of Wilcox's ladder. It's just giving out information to people and making sure that communities are aware. Surveys would fall under consultation. Consultation we would describe simply as asking people for their opinions. Whether we do anything with that opinion doesn't have to be done. It's simply it's a case of collection. PPIE could also fall under consultation, but it could also fall under deciding together. It depends how you do it, because somebody asked in the chat, could David also join the co-op group? If that was the case, then we would say that person, for that purpose, would be sat under deciding together rather than consultation. And then if we go further up the ladder, we've got co-design and co-production and supporting initiatives. And so co-production really falls under the idea of acting together and communities having an opportunity to support our initiatives according to this ladder. I am really simplifying it, but an image is a good way to simplify things like this. So, but I now want to give you an example. I now want to give you a flavor of some co-production that we have done. So it's one project out of many that we've delivered. So we've pulled together a protocol paper, and that was published in NIHR Open Research last year. And just to sort of let you know what it was about, this was a study about the built and natural environment in Bradford and how that affects different communities and their health. And many of you on this call today will know that the built and natural environment is a massive determinant for health inequalities. And so there's lots of research published by us Born in Bradford, by others too, which links green space availability. Green space availability is linked to better birth weight, reduced risk of depression amongst pregnant mothers, and improved mental well-being amongst children. There is another study which I'll try and link at the end of this call, which has linked 10% of mortality in Bradford is attributed to breaching physical activity, air pollution, noise, and green space guidelines. So built and natural environments have a massive impact on our health and well-being. And as part of Born in Bradford, we did a priority setting exercise where we invited thousands of people to contribute across the city, across the district of Bradford, I should say. And we asked them, what are the top priorities for health and well-being, healthy, happy children? What are the top priorities? And the built and natural environment came out as a really strong contender. through that exercise. That was also published. It's called the Priority Setting Exercises, published by one of my colleagues, Chris Cartwright. So we looked at that, and we looked at the evidence, and we decided to put in an application to NIHR to say we want to do some research about how our strategy works, you know, the strategy that I described earlier, on a subject matter which really matters to our communities, and the evidence tells us it really matters to their health. So we went and partnered with 4 community organisations in 4 different areas of Bradford, all sat in 4 different electoral wards as well. And we specifically went to work with different communities of identity. So we wanted to work with people of Pakistani and Kashmiri background in Girlington and Manningham. So we picked Abilities Together, which is a community organisation, community interest company that is operating in Manningham. We wanted to include the white British community, specifically people from a socioeconomic, considered experiencing high levels of socioeconomic deprivation, white British community in Homewood, and that was through the organisation called Out Loud. That is a charity. Then we connected with another community interest company called Connecting Roma, and we wanted to focus on East and West Bowling, which is in the Little Horton ward. And we wanted to work with refugees and asylum seekers. And for that community, we wanted to focus on Great Horton. So 4 distinct communities of identity working in 4 distinct geographical communities in 4 different electoral wards out of 30 potential wards in Bradford. But these 4 wards are still experiencing high levels of socioeconomic disadvantage. So we partnered with them, and each community, we supported them, facilitated them to come up with a community coordinator from that community organisation, whether it was a charity or a community interest company. They happily nominated 4 people, and they became partners in our research plans and design. And we set out very clearly early on, we want to do this in a co-productive way. We don't want to tell you what questions we want people to ask. We want you to come up with the right questions in the right way, and helping us design the right methods and the right ways to record those findings and then analyze them later. So the first thing each community coordinator did, we managed to get them an honorary contract to work with us in the BIHR. But the first thing they did was they recruited 5 peer researchers each, and we then got to build a trusting relationship with those peer researchers. We provided workshops on how do we do co-production, how do we collect data, ethics, and how not to steer people towards answers that you want to hear, but kind of like have an objective way of collecting that sort of information. Why green spaces are important, why the built and natural environment is important. All those things, we took our time to provide the right training for the peer researchers. And another word you could describe the peer researchers is as citizen scientists. So they had all these training, they all were signed up to it. And then we asked them each to recruit. And so when I say we asked them, we agreed as a group of co-production for our co-production program, we agreed that each citizen scientist peer researcher would recruit 10 participants each in their neighbourhood who belong to the same identity as them, or very close as possible to the identity as them, but would meet the identity that we identified. So, for example, in Manningham and Girlington, they would have to be Pakistani and Kashmiri. In Out Loud, they would have to be white British, in etc., etc. So that was the idea. That was our sampling. And the workshops were fascinating. We ended up talking about why the built and natural environment is important, what their local priorities are, how do they define their local priorities, what kinds of questions they think should be included, how do we think about recruiting people who might not be that willing to come forward to take part in a study like this. And we learn as a team so many things through those processes, as much as the citizen scientists, peer researchers learn about the processes that we use. And so in the end, what they decided to do, all of them, is to use a web-based portal, which could be added onto their iPhone, added onto a phone, which we provided, or to a tablet, and go and ask people questions about their built and natural environment, but not only ask questions, but to take photographs and record videos about their local environment, what they like, what they dislike, how does it affect their willingness to use their built and natural environments, how does it stop them, what are the impediments, how does it work, who does it affect, how do we change this? All of these things got covered. All of that data was separately analysed for each community. So we didn't sort of bung it all together and come up with one report. Each community, their citizen scientists and their community coordinator contributed so much time and energy to this. And you can just see there some geolocational maps of where the citizen scientists were operating to collect this data. Now, I have to say they were doing walk-along interviews rather than just interviewing people in their home, sat in their front room. They says, let's go for a 45-minute or a 30-minute walk. And as part of this walk, we'll complete these questions, but we'll also take some photographs. And there were lots of things that came through. So I've just taken some photographs of things that they liked and things that they disliked. No prizes for guessing which one's which by just looking at the slide there. And then they were asking people to, okay, you've taken this photograph, tell us a little bit about it as well. What do you like or what do you dislike about it? And comments came through. Things like, for example, people seeing a massive volume of traffic in their neighborhoods and people parking on grass verges, stopping pushchairs from getting about, stopping cyclists from getting about, but also things that they like, facilities in their neighborhood that would help their health and well-being. Things that they didn't like in certain places was the amount of antisocial behavior and crime, but what they did like are the available community allotments. So all of this data kept on coming through, and we kept on meeting the citizen scientists in workshops and saying, okay, how do we analyze this, and what would be a good way to pull this together, and what do we do with it? What do we do with it? So what they ended up doing is all of them individually, when I say all of them, I mean all 4 of them, started to pull together a report and invited their local community decision makers. So that would be your ward councillors, ward officers, neighbourhood policing team, who else, head teachers, practice managers for GP centres, voluntary sector organisation, chief exec officers, that kind of thing. And then they presented all this information to them about what did they do, what did they find, why it's important, and what kinds of things would lead to change. And so that was a conversation that happened in each of the 4 neighbourhoods. We're now at this stage of pulling all that data together to try and pull it into a report, to pull it into a publication to say, we tried this method, this is what we've learned, these are the things that we found. And so we're planning to do a paper just on the findings and then doing a separate paper on the evaluation of our approaches, because we had applied the co-production strategy and this was like the proof of concept. Did it work, and what were the barriers? What made it possible for some people to come and take part in this kind of a study? So that's one study. And I think, Jabu, you wanted to talk about one other study to give a similar example of something else. Is that right?
That's right, yes. So I've been working with a group of young people aged between 15 to 23 on the AIM project. So the AIM project is looking at adolescent interventions for mental health services. So for a couple of weeks now, or for a while, we've been doing workshops with them. So trying to find out what really matters to them in terms of mental health support and in terms of the mental health services. How are they helping these young people? Are they working in isolation? Are they meeting with the young people, perhaps with the support of the parents? Are they working in collaboration with the teachers? How are they doing what they do? So we've been finding out a lot of information, a lot of lived experience data really has been collected. And from then on, we're now looking at some questions for the citizen science project. So this is where now they'll from the very beginning, we'll be looking at a research question, and they've mapped out a couple of questions. So there were 8 in total, but those have been narrowed down to 2 questions. And those 2 questions, hopefully soon, will become 1 question. So we hope from here on that we can also work in collaboration with the teachers, with the practitioners, with the clinicians to see like, okay, the young people have said X, Y, Z, but how do the professional experts see it? Is there anything missing? Can we maybe strengthen the question that the young people have come up with? And then we'll go back to the young people and look at the methods of collecting that data. So they might decide that they would like to interview maybe other young people, let's say on a topic to do with mental health services coming into their homes and supporting them together with their parents. So that could be a topic. And then we might speak to the parents from then on, but it's about a matter of finding out a method of which we can go about collecting that information from there. And then they'll go off to find that information together with the support of the peer researchers in a sort of a similar fashion to what Shahid has described earlier. And then once the data or once we get the information, the young people will be key people or individuals to helping us to analyze that information and then interpret it. And then from then we can again disseminate it within in schools or communities, and they'll be key part of the citizen science project really. And just to let you know, with this citizen science project, we are in the infant stages of developing the research topic itself and then doing the research and collecting the data. So it's a work in progress, but the journey has started. So as I mentioned, we're now at a stage whereby the young people have come up with a number of questions and we're narrowing those down. And instead of working in isolation with the young people, we'll be having conversations with those mental health services and the parents. So we can get that one strong question and then we can then go off with these young people to hopefully finding out the answers, and hopefully with what we find, you can feed back into the research and help them when it comes to the interventions themselves. Because it's all about the interventions really. What can help these young people to cope with their lived experiences of mental health? Or how do we make mental health, how do we support them when it comes to their families, if they're coming from families who might stigmatize against maybe mental health. So we're in the infant stages, but the journey has started. So I guess as the project goes on, as the research goes on, if we have another session next year or at some point, we will let you know where things are at really. But that is all.
Thank you so much. Kate, that really is the end, and I just want to hand it back to you now.
Yeah, that's lovely. Thank you so much, Shahid and Jabu. That was really interesting. There is actually a couple of questions in the chat already. They're both actually from the same person, from Kate Quester. So I'm just wondering if Kate's got her microphone, and maybe you could ask Shahid and Jabu the questions. If not, it's absolutely fine. I can. Oh, yeah, you're there. I can see you. So I'll hand over to you for that discussion. And if anyone else has got any questions, feel free to put them in the chat or put your hand up. It's down at the bottom where it says react if you're not used to using Zoom.
Oh, yeah. Thanks so much. It's lovely to just touch base with the kind of research co-production, latest thinking and intervention. So it was really interesting. It was really around the kind of different governance levels. And I know probably, Shahid, we might have had conversations in the past around this, but just whether thinking about whether some things require ethical approval or not. And if you've got these different categories with PPIE roles, co-production roles, and then peer research roles, and just if there's any sort of advice or clarity around differing levels of governance and safeguarding and such like for these. I think that possibly covers both of them.
Yeah, really good to see you again, Kate. Oh, I can't see you, but really good to hear your voice. And I haven't seen you in a little while, but it's good to connect again. Yeah, they are different. So for patient and public involvement, you don't need any ethical approval because it is really about trying to consult members of the public about whether we're doing the right thing. So ethics will usually ask you if you've done that. So there's none needed for that. However, for co-production, we've found for a number of projects that there have been some challenges because if you are, for example, the study that I talked about, which entails citizen science, the ethics committee wanted to know, how do you going to make sure that these people who are going to be going out and connecting with people and getting this data are right and proper people, and how do you sort of have governance systems in place? So our response to that was, this requires people to have safeguarding training. So we organised safeguarding training for the citizen scientists in that case. For another study, it was a case of similar kind of setup. It was a case of people going into people's homes, and the ethics panel were not very comfortable about who takes ownership of that. Because if it's the community organisation who's responsible for the peer researchers or citizen scientists, how sure are you as an institute that they've got their systems in place if anything went wrong? So these are challenging questions that come up quite a lot in ethics committees, because quite honestly, not many of them are used to how this way of working works. And so we're having to sort of like respond to individual requests or questions that they pose to us, rather than say, this is exactly how we'll do it. Different challenges come up with different things. Some studies, if you're not going into people's homes, it's less of an issue. One way that we've done, one way we've resolved one of the other studies, is to say people will go in pairs rather than go as individuals, and then that kind of like gives it another layer of protection. I guess if I understand your question properly, and if I stop waffling, sorry about that. It's a case of, it is different for PPIE and for co-production, and especially if it's co-production with members of the public going and doing the data collection.
Yeah. Yeah, it feels like there's maybe some more clarity around the PPIE side. And I think, again, if it was a peer researcher role, then you could certainly understand that there would need to be ethical approvals there. I suppose the term co-production for me still seems like I'm not entirely clear whether that could potentially overlap a little bit into both of those areas. But I think your point is, if in doubt, probably ask and check if it's anything that sits clearly outside of PPIE remit.
Yeah.
Okay.
Yeah, it is a challenge though, so it's a good one that you brought up. It's not. The trouble is, it's not as straightforward as we will do this and it will resolve that, because different ethics committees get wound up by different things, and it looks like when people are, so if it was just co-production where there's no citizen science bit involved, so they're not going and doing data collection as an example, less of a problem. But if it's people who are in our copper project, for example, where they are going and doing citizen science type of work, then yes, there's more issues and you have to contend with them.
One other really quick reflection that just came up was around definitions of engagement as well. And I think outside of research, there's maybe a feeling from what I've seen, for example, the World Health Organization's definition of community engagement is seen as that sort of umbrella term that might encompass different levels of involvement within it. Whereas when you're talking about engagement in research, it's slightly different, isn't it? And more specified with those involved definitions. So I can see that kind of coming up. The more that organisations go and do their own engagement, and the more that research working with people takes place, is there a sort of a need for us to just bear in mind the two different kind of settings, that research co-production versus service co-production at all? But maybe that's for another
No,
time.
if I could, no, it's you're always on point, Kate, and I think so. Involved don't exist anymore, as you know. They were the jewel in the crown. Then it went to Centre for Engagement and Dissemination, then Maximising Impact and Public Partnerships, and then the latest announcement is they've gone. But before involved went, they came up with those solid definitions of involvement, engagement, and participation. However, so we put this in the paper, the World Health Organization have a different definition for participation compared to what involved have. And that sometimes does create with tensions about what we mean when we're talking about participation. They don't have the same problem as far as I can see for engagement, though, unless it's appeared and I've missed it. But part of the problem in the world of research is that people use these terms in slightly inconsistent ways, shall we say. So we try to fill that void by saying, okay, here's a summary of what we think people mean or what the literature is telling us what it means. So that was our attempt to try and resolve that. Sorry, I can't see anybody now. I don't know if it's anything I said.
I've unshared your screen, Shahid, in the hope that like you might be able to see people, but
I
it's
can,
fine.
I can see now again. Yeah.
Oh, good. So thank you very much. So we've got time for one more question, and there is a question in the chat. I don't know if it's somebody's name or a nickname, but it's Keravika. I don't know if your microphone is working. Otherwise, I can read the question out. If that's, oh, there you go. You're there. Hi. Oh, we can't hear you though, actually. I don't think you're on mute. Try again. No, I don't know if your headphones are maybe a bit wonky or maybe not working with Zoom. So I'll read the question out for now while you have a play around with it. So Shahid, it says, on the basis of what you said, PPIE not needing ethical approval, what would happen if you want to report on PPIE consultations and how they influence the research process in the paper? I assume it would have to be purely descriptive rather than using any quotes from PPIE participants.
Yeah. So there's two bits to that. So you could report using GRIP2 guidelines, which are commonly available. There's a shorter version and a longer version, which state how you did patient and public involvement, and you could include that in your paper. You wouldn't include the results from your patient and public involvement exercise. What you would say is that this is how it influenced our research. If I'm understanding the question rightly, that's my answer. The third thing, which is unrelated to that question, but kind of like helpful, is there are ways to evaluate how useful your patient and public involvement was. And there are toolkits out there, such as, I can't remember the names of them, but I know the abbreviation. So PP, triple ET is one, peers is another, the 4 peers is another. So you wouldn't include your results from the PPIE in your paper to say these are the results because we did PPIE, but you could say this is how our research was influenced, and GRIP guidelines are a good way to do that. Sorry if that was jumbled, but I've got a thanks, so
Yeah,
hopefully
you've
that
got
makes sense. Yeah.
That's lovely. Well, this is the last chance. If anyone else has got a question, like I said, feel free to put your hand up or put it in the chat. I don't know if anyone's thinking about that. Well, in the meantime, I'll just say that we've put our details in the chat about the newsletter and the YouTube channel. The slides will go around, and also this will be recorded as well, so people can catch up and share it with colleagues if they've not been able to make it.
Can I say a final word?
Yeah, of course,
It's just to say that when you hear about the COPPA, the Centre for Co-Production and Peer Research, that's what we're working on. So Jabu, me, and 4 or 5 other colleagues. And this study that I just briefly described today was the first flagship study from there after the co-production. So COPPA, if it comes around as a term, that's what it means. I just wanted to let people know because there's so many different concepts flying around. I didn't want people to get it mixed up with anything else. Okay.
I've just put a link for a little bit of information about COPPA as well from our website in the chat.
Thank you.
If anyone wants to click on that for more information, and there's contact details there as well. So thank you very much, Shahid and Jabu. And hopefully we'll have you back on for another one soon.
Thank you so much. Thank you, everybody, for attending and contributing. See you all. Bye.
Thank you, everyone. Bye.